medications. Which one is your sublingual? Which medication?
Nitroglycerin.
Nitroglycerin. Okay, let's see. Let's keep going. So administering medication safety and clinical judgment, administering or assisting with medication is a serious responsibility. So know your medications, obviously, know the side effects, what they can do, what they physically actually do in the body, and obviously use your best judgment when it comes to that. I know we talked about this before, offline versus online medical direction. So I'm not really going to speak on it unless anybody has a question. Does anybody have this question about offline versus online medical direction? Okay, if nobody has a question, please write these down. Offline medical direction, do not speak to physician, use standing orders. So standing orders, which is the exact same thing as offline medical direction, it means just that for any given scenario, there are certain steps you're supposed to take, all right? There's something in place to take care of this kind of patient without you having to talk to a doctor, all right? So an example of this would be a standing order is that if a patient has chest pain and they are prescribed nitroglycerin, you can give them a dose of nitroglycerin as long as they haven't taken 3 already, right? That's like one standing order. That's an example. Online of medical direction would be that example that I used earlier. So if your patient has taken 3 dosages of nitroglycerin, but they still have severe chest pain and they have a good blood pressure, and you think they can benefit from maybe giving them a 4th dosage, then that's when you would go to online medical direction. So that's just one example. So you can talk to a physician or a nurse or whoever is on the other line of the receiving hospital. Any questions about this? Nope. Does anybody want time to write this down? Or you guys good?
Good.
All right. All right, if I write, so this is something you have to check for every medication before you actually give it to the patient. So do I have the right patient? So you have to make sure that the patient's name is actually on the bottle, on the prescription. Is it the right time to administer this medication? So again, like nitroglycerin, you don't want to give it more than 3 dosages per patient, and also you want to wait at least how long between each dosage? That's a question. How long do you want to wait between each nitroglycerin dosage?
5 minutes.
5 minutes. And why is that? Anybody? Why is that?
Could take 5 minutes for the drug to become active.
Exactly. To work in the body. Is the medication the right medication? So obviously, if they have wheezing, they might not need nitroglycerin, right? So it's for the right condition. And then is the right what is this the right dose? So usually for you guys, for EMTs, you guys don't have to worry about the dosage. It's already kind of set in place when you give the drug. You guys want to make sure you don't give too many dosages, more than 1. And then, am I giving this medication by the right route of administration? So what is the route for glucose, Andrew?
It's orally ingested, so through the mouth.
Orally ingested, good. And what is the route for, let's see, epinephrine, Jessica?
In the thigh, like the outside portion of the thigh.
So yeah, so it would be IM, so intramuscular means that it's injected in the muscle. So that's the route for epinephrine. And let's see, what's another one? What is the route for? Let's see. Oh, so what's the route for albuterol? Anybody?
Inhaler.
Inhaler. Good. All right. Let me see if anybody else is trying to get into the. Nah, nobody else. All right. Okay. All right. Think about it. What would be the potential risk to the patient if each of the 5 rights were not checked prior to administration. So a whole bunch of stuff can go wrong. So if it wasn't given to the right patient, obviously they're gonna have some side effects they don't want to have. Is it the right time to administer this medication? So let's just go back to nitroglycerin for this one. So if you were to give the nitroglycerin, let's say you waited a minute or two instead of 5 minutes. What's the potential risk there? If you were to give a patient nitroglycerin back to back within 2 minutes instead of waiting your 5 minutes, what's a possible situation? Anybody?
You could drop their blood pressure too low because you're overdilating those vessels.
Exactly. You haven't given the first dose enough time to react in the body, and so if you stack another dose on top of that, it could possibly make the patient crash because you didn't give the first dose enough time to react in the body. Therefore, you don't know if that patient actually even needed the second dose. You guys follow me with that?
Yes.
Okay. Is this the right medication? Obviously, you want the right medication, and then the right dosage is actually it's important for you guys also. But like I said, as far as dosage goes in EMS for basic life support, it's already preset for the most part. These are the routes. So if you don't know these routes, please write these down or screenshot them. So oral or swallowed, that would be your activated charcoal and your glucose. Sublingual, we're talking about nitroglycerin, either in the form of a tablet or spray. Inhaled, so that's your albuterol. All right. Intranasal would be your Narcan. So your Narcan can be intranasal, meaning that they breathe it into the nostrils. And then intravenous, obviously your IV, that would be your advanced EMT, paramedic, or nurse, putting the IV in your patient. There's more. So intramuscular, that's your epinephrine, but also Narcan or naloxone, whichever name you want to use. That one is given either intranasal, so in the nose, or you can also give it intramuscular. They also have that type of administration for Narcan, all right? So Narcan can be given intranasal and or intramuscular. Subcutaneous means that you're just injecting into the fatty part layer of your skin. Intraosseous means that they, instead of putting a needle in your veins, they put a needle in your bone marrow. And that usually occurs whenever your paramedic cannot get an IV into a patient because they're dehydrated or they just can't find the vein, they go to intraosseous because the blood is actually created inside the bones. And so that's one way of getting medication into a patient, IO. And then endotracheal route is when they have an advanced airway, a tube that goes straight into your lower airway in the trachea, and you can administer medications that way also as well, depending on the situation. But that would be your paramedic also as well, obviously. Questions on these routes? You guys want some time to write these down? You guys good?
So can a medic do the intraosseous?
Absolutely,
no?
yeah. Paramedic, absolutely, yeah. So I know when I was working down in San Diego, the rule was that if you can't get a stick and 2 IVs, so it means that if you can't get an IV after 2 tries, you automatically go to intraosseous. It's easier. So yeah, medic can do that. Go ahead.
The intraosseous, how you were just saying that if you can't do it in 2 sticks, you go ahead and do the intraosseous. Is that under any situation, like if you can't do it in 2 tries, or if it's just like if it's life-threatening?
Usually, I mean, I wouldn't say life-threatening, but if the patient is in serious condition, whether they look like they might be crashing to where it either is life-threatening or it might become a life-threatening situation, then that's when you would do it. Obviously, if you're picking up little Timmy from the park that sprained his ankle, he doesn't need an IV, right? But yeah, like, so if it could become life-threatening because he crashed from, shock or whatever, or if it is a life threat, then yeah, that's when you would do that. Gotcha. When you need access. All right, pharmacodynamics. So if you do not know this definition, please write this down. Study of effects of medication on the body. So what effect will medications have is pretty much how the medication works in the body and everything that happens as a result of the medication entering the body. So please, I'll give you guys a few seconds. This is one of those terms that you have to know eventually because it will come up again. So I'll give you guys a few seconds for that one, all right? All right, I think that was enough time. So let's keep on going with this. We're almost done with this lecture, by the way. It's a short lecture. All right, that was it. So after administering medication, reassess your patient. Obviously, after you give a drug to your patient, you want to see how your patient reacts to that drug, okay? Don't just give a drug and then not pay attention. That's the worst thing you can do to your patient. And obviously, clearly document medication administered. And the biggest thing for documentation is because, well, one, it's for the patient themselves, for their record, but also it's for our records, and not just our records, but it's also for that ongoing care of the patient. So in order for the patient to get proper care in the hospital, and then even after that, everything has to be documented and everything has to be known as far as what happens to